The lack of communication between hospitals, family doctors, specialists, and diagnostics is unfortunately commonplace in Canada. Last week, Quebec unveiled its 2024 to 2025 budget, which allocates $902.5 million over 5 years for accelerating a digital shift in the healthcare system. Samra Faraj, who holds the Canada Research Chair in Technology, Management and Healthcare at McGill University's Faculty of Management, says that the pandemic was a wake-up call for Quebec to prioritize modernizing and digitizing healthcare. Joining us now to discuss digitizing the healthcare system is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us again on Forum Daily.
Great to be here, Julie.
You work out of Toronto, and of course, each province is different, but to give our viewers an idea of the issues with the current system, what sorts of obstacles do you deal with when trying to obtain the files for a patient from various doctors?
Well, in Toronto, I think in many other places, when you try to obtain patient files from various doctors, it can be quite challenging. Each doctor may use their own filing system. It could be paper-based or digital. There's no real standardized method for sharing information between practices. Now, we use a digital filing system, but many of our colleagues in the city do not. And so this non-standardized approach, it can lead to a lot of delays in accessing important medical records. And the concern here is the people who really suffer from this are the patients because of poor continuity and quality of care.
Now, these information silos often happen within hospitals. Does this make it difficult to coordinate treatment among different departments?
Yes, in hospitals, surprisingly as well, we do get these information silos. They can be quite common, and it can make things very difficult to coordinate. Classic example is a patient will be admitted to the emergency department who may recommend to undergo some tests or procedures that are not immediately communicated to the primary care physician. And these tests may have already been done. And we see this pretty often with lab tests and imaging in particular. And so this lack of integration really results in a lot of redundant testing, oftentimes medication errors as well, which lead to delays in treatment.
Can you give us an example of where digital health systems are being done right, either in Canada or elsewhere?
Well, in Canada, we've got some examples. Alberta has certainly made some good strides with the Alberta Netcare system. In the Ontario medical world, I can give you a personal example. So we in the Appletree Medical Group, we have one chart per patient, which can be accessed by any of the patient's physicians, surgeons, or specialists, which includes all notes from doctors, all prescriptions, all lab tests, all under one roof. But the most impressive, I think, is outside of Canada. It actually is in Estonia. Estonia's e-health system started around 2008, is used now by 98% of their population. It allows patients to access all of their medical records online, and it also enables electronic prescriptions and has very good communication between healthcare providers.
Many healthcare professionals continue to rely on fax machines to mitigate the risk of patient information being compromised, such as a cyber attack. But what are some ways that this system remains inefficient?
So the technology for the fax machine, at least the beginning technologies, was invented by Alexander Bain in 1843. Of course, Xerox comes in 100 years later to make it a bit more viable in the consumer and commercial sector, and not really that much has changed. So fax machines have been a staple in healthcare communication for decades, and really are quite inefficient in today's digital age. I think the major issue we all know is that fax documents can get lost or misplaced very easily. And if you do manual faxing, which I hope a lot of people don't do in healthcare, but those receiving the documents and putting them in the chart is very time consuming as well.
What do you see as some concerns with having a digital healthcare system?
I think the biggest concern has always been, the issue with data breaches or unauthorized access to sensitive patient information. It's interesting because we do live in an era of data breaches, and we have to accept that at any given moment, our email accounts, bank accounts, credit cards, they're all susceptible to these data breaches. So overall, when we look at healthcare, I think there's a lot of challenges with transitioning to digital health. But the benefits of it really with coordination of care and efficiency and patient outcomes are quite significant.
Once again, thank you for your time.
Thanks so much for having me.